Good afternoon, everyone. Welcome back to another edition of Dojo Live. I am Tulio Siragusa, broadcasting from Southern California. Today is Thursday, July 22nd, 2021. We're talking today with Marc Rippen, who's the CEO of Alertgy, and we're talking about AI and software, and specifically around diabetes and how these technologies can be leveraged today to cure extremely challenging health problems like diabetes. But I want to welcome co-host Carlos Ponce, who is in Cuernavaca, Mexico.
Pleasure to
And
be here as ever, Tulio.
and we have a cameo from Marielle Navarro from Chihuahua, Mexico. Hi, Marielle. Welcome back.
Hi, Tulio. Thank you.
All right. We wouldn't do this if it wasn't for our guests. So, welcome, Marc Rippen, to the show. I know you're broadcasting from Florida. It's good to have you with us.
And thank you for inviting me. And it's good to be online with you guys.
Great. So this is a very interesting topic. Not too long ago, we spoke about how AI and software could help with problems with cancer. And we had a pretty interesting conversation about what's being done in that space to help cancer patients gain access to better care, because AI can speed up the process of how physicians and practitioners gain access to what's working and what's not working, right? What usually would take many, many years of research is now in a vacuum accessible very quickly. So we learned a lot there. But today we're talking about curing extremely challenging disease. It's one thing treating, it's another thing curing. So it's a very curious topic. We want to dig into it. But before we do, let's get to know you a little bit, Marc. Please tell us about yourself.
Well, my name is Marc Rippen, and I was born in North Africa, Tripoli, Libya, and I've lived all around the world. Most recently, I was a director of engineering at Stanford Research Institute, where I did a lot of really interesting research and development in underwater sensing technologies for the Navy and Special Ops and DARPA. And little I realized where that would wind up, which is where I am now. It's actually the core technologies behind what makes it possible for us to see the spectrum that's critical for diabetics.
Interesting. Tell us about Alertgy. What is the company all about?
Well, about 3 years ago, I woke one Sunday morning, and my wife, who's a nurse, usually takes it easy on Sundays, wasn't in bed with me, and I was concerned. And I called her name. She wasn't there, so I walked over to the living room, and she's sitting in the couch, and she's like just staring into space. And I go, "Good morning, Sue. Are you okay?" No response. And then I realized, because she's a diabetic that's taking insulin, that she was having a low blood sugar and that she was about ready to go into a coma. So I went and got some orange juice and I made her drink it. And about 5 minutes later, she just shudders and she goes, Where am I? Where am I?" And I said, "Sue, you're at home. You're okay." But it wasn't. I still break up when I think about it. If I wouldn't have woken up when I did, she would be dead. And so I decided that I was going to do something about it. And it turned out all this research I'd done in the past, all were the answers to solving the problem. And so I started Alertgy to develop a non-invasive way to monitor somebody to make sure that their blood sugars are in the right levels. If they're too high or too low, they alert not only them, but also their loved ones in case they're incapacitated. And so the first device that I built actually worked, which was unusual because I've done a lot of work in the past and you have to go through many iterations. But anyway, that's how the company started. And that's really what we're trying to do is to save lives of people, take the worry out of it, and improve the quality of life.
Thanks for sharing such a beautifully intimate, vulnerable story. It seems and it sounds as though the foundation of your company is really love. I mean, what a beautiful story. So let's learn what we can and dig in. Carlos, please introduce the topic today. Let's kick it off.
Of course. Thank you, Tulio. And of course, thanks to our guest, Mark, for being here with us today. And well, the topic as chosen by our guest is AI, unlocking the data in the human spectrum. And as you mentioned, Tulio, we're going to be answering the question, can AI and software help to cure extremely challenging health problems like diabetes? Well, so, Mark, tell us and the audience, please, why did you choose this particular topic, and why did you feel it was relevant for today's day and age in the health tech space?
Well, because what we're actually measuring with the device is the dielectric spectrum of a human body. And in that spectrum, just like in the DNA of your cell, where there's all this information that tells your body what to do, and could also be used to determine if you have genetic disposal to some certain types of diseases, whatever. This spectrum tells us what's going on in your body. There are parts of the spectrum that we've identified that relate to the glucose levels in the blood. And so we can determine real time in the blood what the glucose level is with just a wristband device that doesn't require them to have any penetration. But in this spectrum that we're gathering from all these people, we have a real treasure, a treasure of other things that are being seen that we don't know what they are yet. We just discovered that we can measure insulin directly as well as blood glucose. So now we can provide a solution to people that make the insulin pumps where they can monitor both of those things at the same time and create the artificial pancreas, which would then eliminate the disease of diabetes because you have a way of controlling everything just right.
Interesting. So what does the device look, what is it, how does it work? What does it look like? I mean, it sounds very fascinating that you could
It looks like
look
it
at
just
the body spectrum. Tell us a bit more about that. We're
yeah.
not
So
aware what all this means.
it looks just like a a sports watch or a smartwatch basically.
Uh-huh.
And so the device that measures your spectrum is located on the bottom side of the wrist, and you won't even notice you're wearing it. It just basically collects the data, and then it alerts you if you set it to alert you at certain points when your blood sugar gets high or low. And then also it alerts others if you don't respond to the alert, so that they know that you may be in trouble and you need help. So you wouldn't be able to tell if someone was diabetic because they look like they're just wearing a smartwatch.
Okay, so but how does it allow it? Or does it use magnetic technology? How does it actually go and determine this kind of information?
Yeah. So
What's the
what we
technology that allows that to happen?
do, we use radio waves. They're very low frequency, very low power, and we look at the reflected signal back from those radio waves, and that gives us a spectrum. Just like if you took a prism and you break up light into all the different colors, our system basically is breaking up that spectrum into all different colors too, and the different colors mean different things. Some of them relate to the amount of glucose that's there, or what else you're measuring. So basically, you're creating a spectral image of different frequencies of RF, and how they change as they interact with the key components in the body.
So is it safe to say that our body is giving off these kinds of signals always? I mean, like as if we're like connected to some kind of a network and you just figured out how to tap into it to determine some health conditions? Am I oversimplifying that? Sounds a little bit like the Matrix, right? But I'm curious to learn.
Yeah, no, in this case, what we're doing is we're projecting an RF field into the arm, very, very low power, low frequency, perfectly safe. And then we're looking at just like a radar signal that comes back.
Okay.
And that spectrum, or like ultrasound, if you think about an ultrasound, right? Basically, you generate a spectrum, and then from that spectrum, you can look for different things to identify what they are and help you come to some good conclusion as to what you need to do.
Brilliant. Carlos, I think you had a question.
Yes, I was just making sure that I was on mute as usual. Mark, I have a particular interest in this topic, and let me explain. I am also exposed to some kind of diabetes. Not me myself, but I have a. When I say exposed, it means that it's happening in my family. My wife's middle son, he's 31, and he's had diabetes type 1, I think, which is juvenile, the one that happens to young people. And so he's been kind of struggling with the problem with diabetes for many years. Especially, it has been especially rough. He says, as you can imagine, he was a little kid when he was first diagnosed with it. So it's been a rough ride. So what I really like about what I'm seeing here about the technology is about the non-invasive part, right? So I think that is a winner, because I've seen him deal with what's it called, the needles, the syringes.
Okay. Yeah, basically prick yourself and then you have a test strip. My wife's fingers used to be black from using that. So
so that can be a problem. So this is very interesting because it's non-invasive. However, the way I see it is, correct me if I'm wrong, okay? It's more to provide the right feedback or information so that the person can act on it, or is it linked to some other process that is going to actually provide you with the insulin that your body needs? How does this part work, please?
So this is really just a sensor that tells you how much glucose is in your blood at this time. So the information you're going to get is the same information that you're going to get if you prick yourself and you use that handheld glucometer.
Oh, okay.
To a number. Except here you don't have to prick yourself and you don't have to do anything. It automatically seeing what your number is every minute. So you can set it so that unless it gets more than, let's say, 130, you don't really care. As long as if it gets up down to like 80, you're okay. Anything lower than that, you want to know it's really low. You want to know if it's really high, because both high and low can hurt you, right? The low will cause you to go in a coma and you'll die very fast. The higher blood sugars will cause other major complications. I developed this technology for my wife, but ironically, I should have known better because my father died from complications of diabetes, which was late onset diabetes, like my wife's was due to gestational diabetes, and after the fourth kid, it didn't go away. But for myself, I just lost 80 pounds, and I thought, man, I'm in the best shape I've ever been in my life. And my wife said, something wrong with you because you haven't changed anything about what you're doing. And I said, no, I'm just nervous because I'm doing this startup and it's just so much effort and running around and doing all this stuff to get this off the ground. And then I went to test myself on my own device. And I thought, well, I'm probably borderline because my father had problems with it. So I drank a big Coke Slurpee and I had 2 donuts and I ate it. And they tested me and my engineer looks at me and he says, are you feeling okay, Mr. Rippen? I go, yeah, why? He says, because 2 of these glucometers say you're out of range, you're too high. And the one in the middle says it's 550. And I went, oh my God, anything over 150 is bad. I was ready to have a stroke. So the irony here is I saved my own life because I didn't know I was diabetic. There's 10 million people in this country today in the US, and in the world there's 120 million people that are diabetic that don't know they have it, and they're walking time bomb. They can have a stroke anytime. And they don't even know that they're sick.
Yeah, it makes you wonder. Last year, a lot of people had who died from COVID that didn't have any morbidity. I wonder how many of them didn't know that they had morbidity, like diabetes, which happens to be the worst thing you can have.
Yeah,
for COVID.
It affects your immune system.
Yeah,
and that's one of the things it does. Yeah.
So let's just go back a little bit. You made an interesting comment earlier about creating the artificial pancreas. What did you mean by that? Is this technology? It's monitoring, right? So it's providing insight. But you say it could also be tied to the companies that may have one of those automatic insulin shot things. Is that what you mean by creating the artificial pancreas? Where these
so what the artificial pancreas is basically just the sensor controlling the pump that delivers the insulin, and then there's another glycogen. There's another compound your body excretes to control insulin levels. So you got glucose, insulin, and glycogen or something like that. And it's this triage that keeps your blood sugars normally stable if you're a healthy person. So when they talk about artificial pancreas, all they're talking about is having a pump that's responding to real-time sensor data to control how much insulin and whatever else they want to put in your system is given your body to keep your blood sugars stable. What we want to do is always keep your sugar stable. If it goes up and down a lot, that's not healthy.
Mark, as someone who created a technology that with the idea of solving a problem, a specific problem related to diabetes, I'm very interested in asking you the following. Again, also kind of biased because of my own personal take on this. I have read somewhere or different places that there is a very I don't know how to call it, but it's a technology that has to do with 3D printing of human organs. So they take this, what they call it, mother cells or something, and they print actually human organs. And one of the things the first things that I thought was, could it be possible to actually have this happen in the near future in a way that we are going to see it ourselves? And if so, let's say that, okay, we're going to be around when this all materializes. What sort of associations or integrations do you envision for yourself and for your company with these types of medical advancements at such a high level as printing an organ?
Well, I think what we're really are able to do is to see if they're working the way they're designed to work, right? So because we're sensing what effect they're having on, in this case, the glucose levels or insulin levels or whatever. And so it provides a feedback, biofeedback, if you will, to whether or not, so like for instance, different kinds of diabetics have different reasons for being diabetic. One of the things that we can now test for this with the system that we have is we can look at how insulin resistant a person is. What makes that person diabetic? How does that disease progress? We don't really understand a lot about it because there's no data. But with this type of a tool, we can now get so much more data and have a much better understanding as to what's happening and how it's affecting, things in the body, because we can look at all these different things in that spectrum and see how that spectrum is changing. And so they're coming out with all these different kinds of insulin. So which one is the best for this person for the stage of diabetes they're in? Now we can really fine tune the treatment to be the most effective treatment for that individual based on their biochemistry, because everybody's different, right? Everybody's going to be different in the way that they respond to things. So here we can really, people can customize their own care, how things are done in terms of helping them with manage their disease.
Interesting. So because of the real-time feedback, you can do that, right? You can start to see what works, what doesn't work, instead of, okay, let's see you back in 2 months. Meantime, in those 2 months, someone could have such a bad situation.
Yeah.
So, can it get to a place where some of those learnings and patterns that you begin to discover over, let's say, the next 10, 20 years, that we could learn, predictively who's at risk, maybe in their 20s or 30s? Is there a thought around that?
Yeah, I mean, that's why the spectrum that we're generating is really the core of our business, because that data is invaluable. When I do a calibration of our device, we have to calibrate our system for every individual. Everyone has to be calibrated on the system because your spectrum is all differently. I can tell by looking at how your body responds to glucose just how bad your diabetes is. Within 3 hours, I can tell you. Wow. I can tell you if you're a type 1. I can tell you if you're a type 2 that's not doing well. I can tell you you're type 2 that's under control. I can tell if you're normal in like 3 hours. And right now they don't do that. I mean, I was taking blood tests in my annual physicals every year without fail, but they never picked up the fact I was diabetic. I probably was diabetic for 10 years before I knew I was.
Yeah, interesting.
And so, I had all this nerve damage. Like, I was wondering, how come my feet are going numb, right? Well, it's because I was diabetic. I didn't know it.
Wow. So how does a consumer get access to this? Is this through practitioners, through the doctor's office? What's your strategy? Are you doing a direct to consumer strategy like a glucose monitoring kind of a device, or is this more something you're partnering with doctors or endocrinologists that could prescribe this? What's your strategy to get this to the market?
So right now, what we're doing is we're going through clinical trials because you have to prove to the FDA that the device works as well as it needs to for people to use it to monitor their glucose levels and decide how much insulin, let's say, to give themselves and what to do. So we've got to go through the FDA approval process, which will take us probably about a year and a half to do. Once we have the approval process, what we're doing right now is talking to major companies that are already in the diabetes space, like Dexcom and Abbott and Roche and other large corporations, that Medtronics, that could put this into their product line and get it out to people as soon as possible. Where we're going to really add value is really looking at the data using artificial intelligence to start screening for not just the glucose, but other things. Like we can find different types of cancer markers in the bloodstream. We can find different other diseases, like viral diseases. We can pick up the traces for those. Also, heart conditions. So we're gonna maintain all the database that's going to be generated from millions and millions of users, and start looking to see what the other information in that spectrum that we've captured can tell us to help them identify. Like, for instance, the NASA, we won an award with NASA because they want to use our technology for deep space, because we can look for radiation sickness, we can look for bone and muscle loss, and we can also look for body fluid shifts before they get to the point where they affect the ability of the astronaut to work. And so, because a lot of times, like the body fluid shifts, they're not reversible as long as you're in zero gravity. And what happens when the body fluids shift to the head, which they do on some people, not on all, that astronaut is pretty much blind, can't do anything because he's visually impaired. But if you can catch it before it gets there, you can put pressure suits on, you can do things that may not be comfortable, but you keep that from occurring so he can still function. Or if he's got radiation sickness, because different people have different tolerances towards radiation. In deep space, you're going to be exposed to a lot of radiation. We can put him in the part of the spacecraft that's better shielded to minimize his dosage, right? We can always look and see how much is there, but it doesn't. Everybody reacts to these things differently, and that's why it's so important, because we can see every individual's spectrum and see how their body is reacting based on what's happening to their spectrum, and use that to kind of help better understand their health.
I have a question, Mark. Hearing you talking about data, like we're using AI for this, and we all know that AI, machine learning, we need information. So the AI can learn, can process stuff. Have you faced any issues regarding this, regarding the testing of the actual software? For example, I know that clinical information, gathering that information for patients is a very delicate subject. How do you address this?
Well, first of all, we make sure that all the data is, not driven by patient ID or anything like that. It's all HIPAA compliant in terms of weighting the data. But basically, what we're doing with AI is we have a reference technique. Like when we're doing glucose, we have a reference technique, which is a laboratory test that gives us what the glucose value is. And then we run a calibration with, we have different amounts of blood glucose levels in the body that we measure. We know what the reference thing tells us it is, and we look at the spectral information that corresponds, that moves along with the glucose, that changes with that. And then the AI more or less lets us correlate that so that we can be most accurate in actually saying, yeah, this is what the glucose is level is based on our non-invasive way. And the reference technique verifies this, but also gives us a way to calibrate the system. So for all these different analytes I'm talking about, we'd have to set up a test where we would control the amount of that in the human body who's being tested, and then the AI helps us look through this incredibly complex data that if you would just look at it, you wouldn't even know what you're seeing. It's sort of like if you would look at the raw data from like an ultrasound, you wouldn't see anything. It's the AI and the everything else that makes that into a picture that means something to you and me to look at. In this case, we don't need a picture. All we need is a number, right?
I'm curious about whether some companies have come to you about licensing this technology. I know you've talked about being the providers of the data and the insights, and making that available, is and also producing the bracelet and making that available. Have you guys thought about a business model where you license the actual technology and the various research or pharmaceutical companies or medical device companies could license and produce this themselves?
Yes.
Is that a thought process? Because
No, Tulio,
if
you
it's
hit
not
it on the
scaling,
nail.
that seems like
Yeah.
that could be the fastest way to
Tulio,
scale,
you
right?
hit it on the nail. My intent is not to be a medical device company. My intent is to get my wife her device like yesterday, because she's really saying, what the heck's taking you so long, right? So for us, that's why we're talking to Roche and we're talking to these guys. We want to license it to them because they're better suited to take it to market than we are. And I don't want to have to spend 2 years going through hiring a sales staff and everything else for what? For me, this is not really about making crazy money. This is about getting this out there to as many people as possible for the most reasonable dollar amount that's reasonable, where everybody's happy, and that people have access to it. And so that means our model is to license this. We will do the data analytics side, and we'll make money using a SaaS revenue model based on reports that we can generate. They're fully reimbursable by health insurance and everything else, and that will fund us. And then part of what I want my company to do as we become profitable is take a good chunk of that money and invest it in university research to look at cancer markers, to look at heart disease markers, to look at viral disease markers, and come up just like the human DNA, where they did that study where literally thousands of laboratories were figuring out different pieces of the human genome. Just have a whole bunch of research groups looking at different pieces of that dielectric spectrum to figure out what it means and what it correlates to. And that's really going to revolutionize the way we do, preventative medicine. Because if we can predict, if we can see something before it gets to the point where it's clinically obvious and you've got damage that's non-reversible to your body because you didn't know you had this disease, it's a lot easier to catch it, like just cancer. Like you catch it early, you can many times eliminate it, or you can stop it cold and not let it get any worse. But once it gets to a certain state, the damage is done. And right now we have 2 billion people on this planet that are borderline diabetic. 2 billion people.
Wow.
And we help these people better manage their lifestyle. If they have biofeedback and they see what the effect is of supersizing that McDonald's, and maybe I'll have a diet soda instead of that, milkshake or whatever, because we're really in control of our own health, and this enables us to have a biofeedback loop where we can see what we do affecting ourselves, right? So if we're serious about getting ourselves healthy or whatever, it gives us a tool to reinforce that, So we would team up with companies like NutriSense and Weight Watchers and those guys to help them provide feedback to people that are trying to do something about their health and improve their health, right?
Marc,
Excellent.
we're approaching, unfortunately, the final segments of today's conversation. So before we finalize it, there's something else that I would like to ask you. What sort of words of wisdom would you like to leave our audience with? It could be pretty much about anything you feel is relevant to whoever's watching. What would you tell anyone who might be watching based on today's topic?
Well, don't ever give up
There you go.
on something that's worthwhile, you know. And I always, when my engineers would come to work for me, a lot of times we would say, well, let's work on this, and they go, well, that's impossible. And I said, never say anything's impossible. I want you to tell me. I want to know how we do it, not why we can't do it. Right. So I think it helps in your life to have a can-do attitude and to be creative in how you achieve what it is you really think you need to achieve. And I finally figured out in my life what my goal was in my life, because it looked, I had all these other dots, they didn't seem to match. But if I hadn't done everything I've done in my whole life, I couldn't do what I'm doing today. And so I finally understand what my purpose in life is. And I think that if you can understand what that is and act on it, then you've led the life.
Thank you, Mark. Appreciate
Yeah,
it.
we appreciate those words. You know, the sages say that your greatest calamities can turn into your greatest opportunities. So, kudos to you for turning what was a serious situation, scary situation with your wife into an opportunity to help people's lives. So we have to keep up with you and keep tabs on your progress, because this is the kind of life-changing technology and innovation that we need more of on this planet. Thanks for being with us today, Mark. It's been a pleasure talking with you. We are done for the week, but don't forget to come back Monday for the recap show at 12 o'clock Pacific. We will recap our shows this week. We will also remind you of the shows coming up for that week, and we can do that today as well. Carlos, what do we got coming up next week?
Yeah, well, Tulio, we have a full week too. Next one. So Monday, we're going to be speaking with Pedro Goes, and the CEO of a company called InEvent. And the topic is going to be how the virtual marketplace is refitting event services professionals. That's on Tuesday. Then on Wednesday, we'll have a conversation with Shannon Ferguson, the CEO and founder of fansaves.com. And the topic, bridging the gap between sports teams, sponsors, and fans. And finally, on Thursday, we're going to be speaking with Haynes Brand, the founder of Breathing.ai. I don't have the topic, but since it's AI, then it should be less interesting than a lot of the AI-related interviews we've done recently. So that's what we have. We have a full week next week. Join us here on Dojo Live, 12 p.m. Pacific, and be safe.
Take care, everyone.